Hello, good evening. It's Wednesday night, and I'm here with Dr. Ojo-Caron, and I'm Hannah, as you see. We are here to talk about sleeping without skivvies, but before we get into that, it's also Black History Month. And the more Black History Months I experience, the more I understand of what was left out of my education. And you hit the highlights, but I think that it originated as a way to deepen and broaden that, and that really it is our history. It is American history. It's not a separate thing. And so we wanted to highlight one particular woman who you may not have heard of before, but Dr. Ojo-Caron, you selected her. Do you want to introduce our lady of the moment?
Yeah, so good evening, everyone. I wanted to highlight Patricia Bath, who was the first African-American woman to complete a residency in ophthalmology. And she was actually the first African-American. And then also the first African-American female to receive a medical patent. And she received that in 1988. She was born in New York and started from humble beginnings in the 1940s, received most of her education through that period of Jim Crow and civil rights movement. She went to Howard University for medical school, went to Columbia University for her residency, and then ended up at UCLA as the first female faculty member in their Department of Ophthalmology. She herself co-founded many different initiatives, institutes, and community health systems for ophthalmology. In 1976, she co-founded the American Institute for the Prevention of Blindness, which established that eyesight is a basic human right. So again, highlighting her because of her efforts in medicine and her being an innovator and also a driving force for not only Black female physicians or Black physicians in general, but for all female physicians. She held many roles, and she was an advocate for not only members of her community, but also for her patients, and understanding that everyone has a right to receive good health care.
It's so incredibly humbling to hear the list of achievements. I mean, to think of her being the first African American to complete a residency in ophthalmology, to take those two major minoritized positions and bring them into that space is just really incredible. And it's then when I think further about how her name isn't in my head, you know, it's not a name that's floating around for me.
Even to think that in 1988, which is, you know, for us, not that long ago, that's our, you know, we're that generation, that it took until 1988 that a Black woman received a patent for a medical device. That's amazing.
Right.
That's amazing.
And it's really inspiring too. I mean, I had kind of a frustrating day today, and when I hear this list, I'm like, get over it.
You know, I want to highlight someone else because I had a tough day today too. And I, you know, with starting this practice, it's been a very challenging time because not only am I doing this as a physician and as a business owner, I'm also a mom to two children who are under the age of 10, who require both a lot of attention, of course, because they're growing children, just personally and also for school. And so I want to shout out my husband, who himself has been an amazing partner in business and also marriage, and then also father to our kids. He himself is a very busy physician who has a very busy practice, but he is able to craft out that time that I can't give right now to our family. And I just think that's amazing. I came home today and I know he was in the OR most of the day, and he's at the kitchen table with my daughter going over her spelling because she has her spelling test tomorrow. And my son is at the table also writing his letters and tracing his numbers. And, you know, so I just we have a lot of support. We have our family that supports us. We have people here that help us with the kids, but I just wanted to shout him out because he's been a really big part of my success in the last couple of weeks of just being able to live. And I want to thank him for that.
That's right. It takes a village. So
it takes a village.
Yeah. But I want to take that spotlight rightfully put on him and turn it in your direction again.
Yeah.
Say that we actually got to speak earlier in the month, and it just released yesterday for Your Neighborhood podcast, is releasing season 4, which is the season of solutions. And the first month focuses on healthcare. And we got to, my partner, Jackie Glass, and I got to have a nice conversation with you, which we took so much gold and had to just edit down to a little piece. But it went back to explore the beginnings of gynecology and how it came from a really painful place, and what that means for you and your practice, and why you even branched out and took this risk and have been able to rely on husband and support network to make Ovocient, why that was so important to do. So if you want more on that, please go check out Your Neighborhood podcast. That's linked on Ovocient's, all of Ovocient's social media. So you can check there.
Yeah.
And before we get into the next section, I also wanted to say that if you have questions, we would love to know them. So you can drop them in the comments, or you can send us a private message on Twitter, on Facebook or Instagram. And all of these videos go up on YouTube tomorrow, the Thursday after we air them. So please send us your thoughts. We'd love to know what you think.
Yes, please send your questions.
So I didn't hear this before we met. But you say sleep without the skivvies.
Yes. Yes.
Go on.
So, I didn't realize some people don't know what skivvies are. Skivvies, underwear, so panties. And so, I say this many, 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 many times in my day, that you need to not have underwear on when you sleep, because just like you need to relax, she needs to relax too, she needs to breathe. You take deep breaths in throughout the day at times of stress, and same thing at night. Allow her to take deep breaths in too, and just air out. The vagina is a place that is in an area where there's a lot of moisture. Not a lot of light, right? Because you have clothing and your underwear on. And so that's a wonderful breathing ground for bacteria and yeast. And so especially for women who have recurrent infections, recurrent vulvar vaginal irritation, itching, sans underwear completely at night.
So you can wear pajama pants, shorts, or whatever over. You're just going to give the immediate area.
Give the immediate area. That's anything that's close contact, freedom. Feel free. Feel free.
I haven't done it yet. I've known you for some time, and you've told me this in the beginning of our relationship, and I still haven't done it. I'm doing it tonight. I'm going to make a commitment here and now. I'm going to take a breath. You wouldn't sleep in your face mask, right?
You would not sleep in your face mask. So why are you sleeping in your panties? Just take them off. Take a break. Take a break. And then, and whatever you wear on top, like if you're going to wear a nightgown, you're going to wear pajamas, that's fine. Let it be cotton. Let it be loose. I think that's the main thing. Let the area not be constricted with tight clothing. We say that anyway during the day, especially again for women who have recurrent infections, that you should not wear tight clothing, wet clothing. We have a question here. How can you prevent a yeast infection? Wonderful question. Don't wear your panties at night. That's the first thing. Second thing, don't wear tight clothing during the day. If you notice your underwear gets moist a lot during the day, either one, change your underwear, which may not be easy to do. Two, you can wear panty liners and take those off and change those throughout the day to keep that area nice and dry as much as possible. Soap, in this country, we have to use soap, but you don't need soap for the vagina. Water is fine, but if you're going to use a soap, let it be something very mild, something like Dove. Yes, a lot of people use Dove for the area, and that's fine. And I say, if you want to use a soap between the legs, that's fine. But between the lips, the vagina, because that's not skin, that's mucosa. That's very sensitive. You should use something very sensitive also. And so another good product is Good Clean Love. They make a wash called Balance. It's aloe based. Many of the ingredients are organic. So that would be something that's better than a drying soap. But we talk about all these external things to do, not sleeping with underwear, keeping the area nice and dry, keeping the area clean. That's all great and well, but you also have to think about the internal. So having a healthy diet, a healthy lifestyle, a diet that's not filled with sugar, that's in what you eat and what you drink, a diet that is one in which you're remaining hydrated with water. Everyone should be drinking at least half of their weight in water, or half of their weight in ounces of water a day. So if you're 100 pounds, you should be getting at least 50 ounces of water a day. And just overall being healthy helps with your vaginal environment.
Mm-hmm.
So
this is all very fascinating. How we've got another question. How do you prevent dryness?
So if it's dryness due to an infection, preventing the infection, one, treating the infection if you have an active infection, and preventing the infection helps to prevent dryness. I do recommend for when women have active irritation, itching, discharge, whatever, again, just water. Even forget the very mild washes, just use water. If you have dryness for other reasons, that's when we talk about bringing moisture back in, but you want to bring back in good moisture. You want to bring back in moisture that one kind of mimics your own vaginal discharge. Everyone should have discharge, and we can talk about that because that's a whole nother talk of normal discharge to abnormal discharge. But again, another good product is that Good Clean Love I talked about. They have a product called Restore, which is also aloe based. Aloe vera gel, that's a good humectant, is a good moisturizer. So applying that to the outside of the vagina is very good for dryness. Sometimes yeast infections can make you really, really, really irritated. And besides medication that can be prescribed, even a steroid cream, you can use some over-the-counter steroid creams like hydrocortisone, just on not talking about inside the vagina where that sensitive mucosa that I talked about earlier is the skin outside of the vagina, the vulva, what we call the vulva.
Mm-hmm. So I dropped the link for Good Clean Love. Is that the best? People should go online and get that.
Yeah. Actually, their products are in many stores, and this is a plug because it's great, and not because I'm receiving anything on the back end. It's a really, really good product. They have a really, really good line. The company's owned by a woman, and it's part of the premise of the company is empowerment for women and vaginal health. So that's a wonderful way to get their product online. You can find it in most stores, maybe not all of their products, but the basic parts of the basic products that they have, you can find it in most pharmacies, most stores.
And then during the daytime, do you have any recommendations about how our skivvies should be during the day?
During the day, especially if you're having, again, irritation or problems, you should wear cotton underwear. Try to wear underwear that's not too tight. So when we talk about thongs or more synthetic fibers or even silk, to try and stay away from those fibers because they don't really breathe. And so they're not allowing air to circulate. Not wearing tight clothing. And again, going back to your clothing being wet, that's also your underwear. And so if you notice that you have more discharge some parts of the month compared to others, putting on a panty liner and taking it off, changing it multiple times in a day. Let that panty liner be scent free. It should not have fragrance because fragrance can be very irritating. Some women also may want to think about using an organic cotton panty liner.
So we're going to cover vaginal moisture as a whole separate thing. We'll talk about that next week. But the main messaging here was just sleep without your skivvies.
Sleep without your skivvies.
We have got 7 seconds. So we have another question that I'll have us answer in the comments. But thanks for tuning in tonight.